This is Dr. David Pomeroy, your host on ADHD Focus. I wanted to remind you that the show is not intended to be a recommendation for diagnosis or treatment of any condition for any specific person. Please consult your mental health professional or doctor managing your ADHD or mental health issues about any diagnosis or treatment-related information that you hear on the show. Refer your ADHD provider to the show if he or she would like more information. Thank you. Hello, this is Dr. David Pomeroy, your host on ADHD Focus, and today we have a particularly important topic to discuss, and that is cannabis and ADHD. There are more and more states that are legalizing cannabis for either medical use or general recreational use, and it has a particular specific effect on the ADHD brain and developing brain, so it's important that we talk about it. My guest today is Roberto Olivardia. He is a psychologist who has a private practice in the Boston area and also is an instructor at Harvard Medical School. Roberto, welcome.
Thank you for having me, David.
Let's just dive right into looking at what's the scope of the issue in terms of what percentage, as best we can tell, of teenagers, young adults are using cannabis.
Yeah, so what we know is, and why this is an important topic is, aside from the fact that we know that there are states, I live in Massachusetts, where it's legal, this is a substance that, not only is the messaging and the marketing behind it being this is not harmful, but even it takes it a step further by saying it's actually helpful, it's medicinal. And a lot of people are buying into that marketing. And the National Institute of Drug Abuse in 2018 have collected a lot of data, and they find that there are a lot of young people that are using all the different forms of cannabis, whether you're smoking it, dabbing, edibles. 1.3% of 8th graders are using it on a daily basis. About 4.8% of 10th graders. That's what the National Institute of Drug Abuse. 4.8% of 10th graders are using daily, and 6.4% of 12th graders are using daily. Now, when they actually look at past year of marijuana use, they find that 11.8% of 8th graders have used marijuana in the past year, 28.8% of 10th graders, and almost 36% of 12th graders have used it in the past year. It is much more common than people think, and much more accessible.
Yes, kind of like alcohol used to be, yes, you can't have it until you're 21, and that's a laugh because everybody knows
exactly
someone who can get it.
And when they look, and exactly, and studies show that with college students in 2018, studies have shown that up to 43% of college students have used marijuana at least once in the past year. 25% of college students reported using at least once in the prior 30 days. And even with vaping, for example, that one study showed that the vaping of marijuana doubled for college students in 1 year alone between 2017 and 2018. And the 30-day prevalence of vaping marijuana increased in college students in another study from 5.2% of college students to 10.9% in 1 year. So vaping, in particularly, where it is so accessible, where people think that there's nothing wrong with it. And so this is something that really warrants us to look at a further examination when you hear that 1.3% of 8th graders are using it daily.
That just blows me away. And vaping, I know that the concentration of THC can be, and often is, much higher than what you'd get just using a bong to smoke the flower. Or even edibles. And I think there's probably a crossover between, I'm vaping nicotine, that's healthier than smoking cigarettes, so there's no problem in vaping some weed. And spins
that's
off
exactly
from there.
right. That's right. And even more so, I mean, just as far as THC, I mean, one of the things that is really important to impress upon people is, I grew up in the 80s, and, Nancy Reagan was telling us, just say no. We had the commercials of the eggs in the frying pan. This is your brain on drugs. And, the dangers of marijuana being a gateway drug. And unfortunately, those messages never really landed, and they were sort of seen as like the butt of jokes and such. And the truth of the matter was that it wasn't as dangerous then as it is now. And I'm not saying it was a good thing then, but just to understand, the weed today is not someone's father or grandfather's weed. Even in the early 1990s, the average THC content in the early 90s was about 3.8%. In 2014, the average THC content in cannabis is 12.2%. So it's quadruple the amount. Now that's considered like lightweight. I mean, I have patients who consume edibles that have 50 to 60% THC. There are fairs across the country, marijuana, cannabis fairs, in which there are contests of waxing and dabbing to try to create the highest level THC, and some people can get up to 80 to 90%. And what's important about that is understanding we should really be thinking of this as a different substance to the brain, because it really is the equivalent of being, let's say, hit in the head, with a small rock, and being hit in the head with a really big rock, in terms of the neurological impact of that.
Yeah, and I grew up more in the 60s, graduated from college in 71, so that was right in the birth of hippiedom, and I don't know, it was quite 50%, but probably close to that in college. And I'd have a joint and you just get silly.
Right.
Certainly didn't get the effects that people are talking about now with a really high percentage. So what exactly does cannabis do in the brain? What areas does it affect?
So one of the most important takeaways is that, unlike some substances which people can sort of point to these behaviors that are maladaptive or that are bad or unhealthy, what we call positive symptoms, and I don't mean that like great, but more positive meaning the presence of something that is problematic. With cannabis, what's insidious about it is that it's more what's not happening that is the bigger problem, what we call the negative symptoms. So the absence of things or the slowing down of things. And and just to keep in mind, what I'm talking about is the research that really is looking at people who are using prior to the age of 25. And for people with ADHD, to know that an ADHD brain takes a little bit longer to fully develop, so we're talking maybe before the age of 27, so a developing brain, that it really alters parts of the brain that are responsible for motivation, for memory, for attention, for processing speed. Studies show that one's ability to learn is a slower process when they're using cannabis, and not just when they're on cannabis, but even people who are regular users during days when they're not using, they find that those effects, can last and can sometimes, with people who are using at a very young age, very high THC, it could be irreversible. Performing complicated tasks, it could affect your time perception, your affect, it reduces your impulse control. And what's important too is, when there are studies that are looking at with rats, for example, who are giving cannabis, that, in our brains, we have neurons or nerve cells, and we want those nerve cells to have as many dendrites, which are, basically like little branches that sprout off the neuron. And, just like that if you and I were driving, if we were driving from, Boston, where I am, to Washington State, where you are, If there was just one road to get there and that road was clogged up or traffic jammed, that would be really frustrating and it would delay the trip. I want to have multiple roads. We want to have multiple dendrites, and so that we have multiple ways of getting our message through and have it be fluid. And what studies show in adolescent rats is that those that are exposed to THC, their neurons form significantly less dendrites. And that is not something that is always reversible. So for people to understand that they're basically messing with the architecture of their brain, the foundation of their brain in such a way that could really impact them, later in life. There was a study in New Zealand, a 2012 study, that found that adolescents who had cannabis use disorder, that there was a significantly high correlation with the loss of an average of up to 8 IQ points measured in mid-adulthood. So adolescents who were heavy users of cannabis, when they did testing and then followed them up years later, compared to people who were not using cannabis, those who used lost 8 IQ points. Like it literally, it's almost like it made them less intelligent.
Sure,
and that's frightening.
Is complex and like you say, ways to get around a certain block. And you look at an adolescent brain that's making a lot of connections, and those kind of get cut back as some areas are used and others not so much. Well, if you limited the amount that can grow or become networks, then you cut some of those back. You're left with less resources that you can bring to things. And I would think that particularly when you put the problems with memory, attention, processing speed, then your problem-solving capabilities are going to be much lower. You don't
That's
have
absolutely true.
That option, and
that's right.
Not come back.
Right, and I think for adolescents, it's important, for them to keep in mind that, the executive demands of life increase, obviously, as we get older. And so a lot of adolescents I work with are like, this is not interfering or impacting with my life. I'm still able to do work and whatnot. And then what they're not seeing is the writing on the wall that, well, when you're 25, when you're 30, and you're having to juggle many more things and shift and balance and regulate, which already is problematic for people with ADHD. When you have to do that more, that's when you're really going to see the impact of it. And now keep in mind, I do work with adolescents who are already severely compromised because of their cannabis use, but a lot of them who are not in that zone where they really understand the full nature of it, because they're saying, I don't see a problem. But what we know is that it's happening internally in their brain. They just don't know that the architecture is being built, basically.
Yeah, if you aren't using it, you can't see that you're not able to use it.
Exactly.
Sure, I would think you'd say, gee, all you have to do now is go to school, get your homework done. Yeah, you have to maybe do your laundry, but be there at meals. You don't have to shop for the meal, plan the meal, and take care of cleaning your apartment or room and keeping your calendar in terms of your job, your social things. There's so many more demands on that executive function that if you can't put those things together as fast, you're going to fall behind.
That's right. That's right. And there are also health, physical effects too, that people think, well, first of all, the biggest misconception is that you can't get addicted to it, and that's not true. That actually studies show that about 9% of adults and 18% of adolescents satisfy the criteria for a cannabis use disorder or a dependence on it. And we're not just talking about a psychological addiction, which is what a lot of people think is like, oh no, you can get psychologically addicted, but you're not physically. You are. With the levels of THC that we're seeing now, we absolutely now, if we were to say this in the 60s, I don't know how many people could be addicted with the THC levels then. I don't know. And I guarantee if it was existent, it was much, much less. But what we do now is the science is showing us that. So that alone is important. But in terms of studies on the heart find that it actually can, even though we think of cannabis as chilling people out, that over time it actually makes the heart work harder. It dilates the blood vessels. It can raise resting heart rate. One study found there was a risk of heart attack is several times higher in the hour after smoking. If you have a pre-existing cardiovascular problem, then smoking weed puts you at major risk. For people who take methylphenidate for their ADHD, to know that methylphenidate and cannabis interact with each other in a way that could cause increased heart strain. And then from a psychological level, it can lead to issues with anxiety, with paranoia, with depression, but knowing especially that for most people with ADHD have a comorbid disorder like depression, anxiety, binge eating. I mean, I work with a lot of people who have other issues, and it always exacerbates those problems as well as exacerbating all of the ADHD issues. So although there's this gravitation that people with ADHD will say, well, I'm doing it because it helps my ADHD symptoms, we know from science, and I always preface to people out there when I'm talking about this, I don't come from this from a moral perspective at all. Right. Like, in fact, I'm a very strong ally for people in recovery. I have people in my life who are in recovery, and I don't moralize this. I don't think that bad people become addicted to drugs. Exactly. Like, I understand that there are certain people. I have a very addictive personality. Like, I get it. And so I want people to understand I'm not coming from this perspective of, I'm telling you drugs are bad because that's the thing to say. I'm going with the science, and what the science is showing is it's very alarming. I mean, even when I started delving into the scientific literature, I was surprised by some of it. I was, just like you were, surprised by hearing how many 8th graders are using daily. I was surprised by hearing how it affects the dendrites, how there can be a correlation for certain people.
That's a major issue in terms of it's affecting brain structure. And like you say, that's something that can affect you lifelong, even though as a teen you don't see it. Hey, I just use it to chill out. And in terms of that anxiety, one of the things I had read was that it's a THC that mainly helps with anxiety, CBD, not quite so much. And it also reduces and takes the place of the endocannabinoids, the essentially little bit of cannabis, we have that kind of effect already in our brain. But it not only takes the place of them, it reduces the production. So then as the THC effect wears off, you don't have these natural buffers to depression or anxiety. So one feels more anxious. See, I need some more. And it gets into that cycle, kind of like with nicotine and cigarettes. That's a little bit more immediate. People say, I calm down when I have a cigarette. Yes, because you're in withdrawal, mini withdrawal from nicotine. Have some, you're more calm.
That's right.
I worry about that cycle. I've seen adolescents, even down to 12. I need a green card or a medical card for marijuana because when I smoke it, I just feel normal. And I'm thinking, you're 12 years old. How do you even have any concept of what normal is?
Exactly.
So that belief that, it's okay, and gee, it's legal, therefore it must be okay. Well, alcohol has been legal, but drinking every day isn't okay.
Right. And at the same time, it's important to validate that it's understandable when we understand the ADHD brain and the understimulation of the ADHD brain, the fact that an ADD brain is more uninhibited. When people say it helps me focus, I'm less bored, it helps me sleep, it grounds me, it slows down my racing ADHD brain, I say I don't doubt that. I'm sure it does all of those things in the short term, in that moment. And I validate for people that I don't think that they're crazy because they find this substance appealing. It makes total sense, especially when we understand how the ADHD brain can really lend itself to seeking things that both stimulate it as well as ground it. And then to tell them, what was that?
Just that it's something new, and yes, if you're a teenager, you're not supposed to buy it, so there's the attraction of you're doing something kind of illegal and a little risky, and that's an attraction. With ADD, you're going to get a little dopamine from that.
That's right. And the novelty, sensation seeking. And at the same time, I tell them, well, just because it's doing those things, it does not mean it's medicinal. And that's what we have to understand as clinicians and for parents out there is there is major millions and millions of dollars of marketing that is being online. There are billboards even, that are pushing this message that this is medicine, and it is not medicine. There's a big difference between self-medicating oneself in an unhealthy way and something that's truly medicinal. And that, I find, is probably the most important point I try to get across to people who are using is I don't doubt that they're having those short-term effects, but then I ask them, how is it working for you in the long term? Like, do you find that you can't find things fun unless you're using weed, that you're using cannabis, and right? Or do you find your anxiety is you're reporting to me that your anxiety is actually getting worse over time, yet you're using cannabis, which you're saying is helping you. It's not helping you in that moment. Just like, you made the analogy to alcohol. Like, if somebody said, oh, I drink 5 glasses of wine every night to go to sleep, and it helps me sleep. Well, I don't doubt that it might help some people sleep, but
3 a.m. and then you wake up.
And not to mention what that does to your health. No one would say, well, then do that. That's what you should be doing every night. Right, exactly.
The benefit, quote unquote, that someone would see in using is that it takes care of those positive symptoms of ADD, what you can see, what I'm experiencing now. I don't feel good, I'm depressed, I'm anxious, I can escape and kind of chill out and relax. But like you say, you don't see the negative effects over long term. And of course with ADD, it's the immediate that makes the difference. Long term that could be next week, that's still long term. But to look at when you're 35, you want to be able to function pretty well, have a job that you can hold on to, have relationships that work, or just be playing video games, and even those you're not going to be very good at when you're high all the time.
Right, or even, or even if... That's right. And also just saying, let's say if you're not, in your parents' basement playing video games and you're working a 40-hour week, but you may not realize that you could be limiting yourself in terms of the opportunities, in terms of the kinds of jobs and careers that you want, the kind of life that you want. Because I also, I work with young adults who are saying, well, I didn't think there was a problem because I was working 40 hours a week. I'm not in my parents' basement playing video games. I'm not, eating to oblivion. And then what they realized, and what I'm thinking of one patient in particular who came in to treatment, and he said, I realized that I consider myself a bright person, he said. And he asked me, he goes, is there research that shows that weed can make you dumb? He goes, because he has ADHD, and he said, I know this is not the ADHD. He goes, I feel like what I thought I could do when I was 30, I feel like I'm so far behind that, and it's not the ADD, because he goes, I've worked through that, and I shared with him some of the research, and he is convinced. He's like, I'm convinced that happened to me. He goes, because he started using when he was 14, used very heavily, very high THC edibles, which, by the way, I mean, even going back to the marketing, is if you see how some of these edibles are packaged, they're packaged as gummy bears, they're packaged as sort of imitation Skittles and M&Ms, exactly. I mean, come on, like it's like with Joe Camel, what did we do with that? We had a very aggressive pushback to say you can't market, to young people, and that's exactly what the marijuana industry, the cannabis industry is doing. But he realized that he was limiting himself.
So what can parents do? How can parents approach this? I can see, yes, it'd be nice to have a way to counter some of the marketing, but in terms of an individual knowing how teens don't believe their parents know anything, would a parent be, and the teen be better served by saying, I want you to talk to someone who can just look at the science and not tell you you're weak or dumb or you're a bad person because you're doing it, because it's not a matter of willpower, particularly with ADD. How can a parent help?
Right. I think at first, I mean, when I talk to parents, I say, when you have a child with ADHD, it's really important to start conversations as proactively as possible about things like impulse control and things like that. I have a son, he's 15, he has ADHD as I do. And I remember when he was young, it wouldn't be conversations about drugs, but I would say, when people with ADHD, when we like something, we like it a lot. And, we would sort of chuckle about it. And I would use the analogy of like Oreos. Like I'm convinced, first of all, that there's some like addictive substance in the cream of Oreos. But I said, Daddy loves his Oreos, and I don't, it's very hard for me to have a package in the house because I can just like rip through it. I said, now I might buy the little package of 6 because I don't want to say, oh, I can't have Oreos. Like I want to enjoy Oreos, but I have to know, I know where my limit is. And I would start with conversations like that at a very young age, like basically introducing the idea of regulation and not having shame that that's something that you have to regulate. That there's no, there's no shame that, yes, there are lots of people that can have packages and packages of Oreos in their house and be fine with it. And that's fine. I mean, that's just what it is. So we want to disconnect from the shame that this is something that could be problematic. And then as he got older, around middle school, we did start having conversation. I'm a big music fan. I love music. And so a lot of times with some of the music that I listen to, some of the artists are dead and have died of drug overdoses. And, when we have seen great, films and movies, and my kids will be like, oh, what's that actor doing now? And I'm like, oh, like I remember, we talked about Chris Farley from Saturday Night Live. One of my favorite comedy movies is Tommy Boy. And he died of a drug overdose, which was, tragic. And they're like, gosh, John Belushi, right. All of these. And so then I would say, when you start school, you're going to start to know people that are going to be vaping and that, are doing these substances, and they're not going to think there's a problem with it. But I say, but number one, understand that there is problems, with that, and I explained it. But then I said, number two, as someone with ADHD, what we know that is a reality is that the bridge between experimentation and dependence is a much shorter bridge for people with ADHD.
That's a great
that if you get if you get a reward from it, it's much more difficult to just say, oh, I'm not going to have any more of that.
Right. The ADD brain being less sensitive to reward, that is needing a relative higher hit of dopamine to get the same reward. And of course, some is good, more must be better. And
exactly.
Dependence, and I like this cycle.
Exactly. And I said that that's really, important, and having those, conversations. Now, the other thing too is to not moralize it. So not, even if you're talking about other people and saying like, oh my gosh, I can't believe the neighbor's son next door, I found out he's addicted to opiates, oh my God, I thought he was such a nice kid, that we want to move away from this idea that bad people do drugs. Lots of really, really good people, very compassionate people have engaged in and have problems with drugs and alcohol. And so we want to move away from that, because then let's say if your child is using, the last thing they're going to want to do is tell you, because now not only are you judging, but you're judging their character. You think that they're bad people. I've had parents that say, what did I do wrong? And I'll say, you have to understand your child is growing up in a culture where this is so accessible. Like, it's not like when we were kids where you really had to go through, like, it took a lot of work, to go through certain channels and people. It is not that way anymore. It is so easy. And so we want to move. And then if you find out your child is using, absolutely talk about the science. And then and if they have a hard time listening because it's mom and dad, even if you set up a one-off appointment with an expert, a scientist who can talk about, like, what I find when I talk with the teenagers, I talk about the brain. Like, I don't even look at it from, oh, you just shouldn't do that. Well, of course they know that we're going to say that.
Well, this is, what's real. Unfortunately, we're out of time, as usual, on something that's interesting, important, and also really complex. But I think we've hit a lot of the high points, and particularly as far as the development of the adolescent brain, and the fact that, gee, I'm fine, it's not going to hurt now. Yeah, the hurt is later, and that's the delayed non-gratification, I guess, is an issue. Well, my guest today has been Roberto Olivardia, who's a psychologist and helps a lot of people with cannabis use disorder, and cannabis is becoming more prevalent. A lot of kids use it, at least try it. With ADD, I think it's easier to keep doing it. So thank you so much, Roberto, for helping us understand this complex topic.
Oh, thank you for having me, David, and for doing this topic, because I'm very passionate in just getting the message and just getting knowledge out there. I mean, knowledge is power.
Absolutely. So, my listeners, I hope you've gotten some good information today, and that you'll get some more next time we meet. Take care, stay safe, wear your mask.